Mr Bailey, it's a pleasure to serve under your chairmanship this afternoon. And I'm conscious that this subject has been raised before, and yet it remains possible for people in the UK to be referred by an NHS professional to a psychotherapist for gay conversion therapy, the so-called gay cure. Mr Bailey, being gay is not a disease. Being gay is not an illness. It is not something that I or any other gay man or woman can be cured of. To suggest otherwise is not just demeaning, it's morally and medically wrong. Not a single medical body supports the concept of gay cure. Neither the Royal College of Psychiatrists, the UK Council for Psychotherapy, the British Association for Counselling and Psychotherapy and the British Medical Association have all concluded that such therapy is unethical and potentially harmful. Mr Bailey, various techniques and methods have been used in the past, and I'll just list a few of them just to give a bit of colour to the level of quackery that we have seen on this subject. Exorcism, and in fact in the Times today there is a young man who was taken to a backstreet exorcist because his parents were concerned he was gay. Then there is cycling. Apparently cycling was a cure for being gay, and I can tell colleagues that as a keen cyclist, that one doesn't work. Then, of course, there is prayer. Apparently, you can pray away the gay. That doesn't appear to work either. Or there is the Austrian doctor who trialled testicular transplants, who took testicles from a heterosexual man and transplanted them into a homosexual man to see if that curbed his homosexual desires. Unfortunately, I couldn't see the outcome of the trial anywhere on the internet, but I'm sure it was of interest to both recipient and donors of the testicles. And I only mention those because it is just an example of how far from the mainstream some so-called cures can be. And it's a far cry for some mainstream psychotherapy. I wanted to put that on record. But I do want to focus on some of the current techniques. And I think it's important to debunk the thought that such so-called cure therapies might be simply gentle counselling, lying on the couch and talking about one's feelings. They are not gentle therapies. Such therapies purport to change a person's sexual orientation or reduce their attraction to people of the same sex. Dr. Christian Jessen, for a TV programme in just 2014, underwent treatment for homosexuality. One of the most extreme cures is aversion therapy. The therapy looks to teach patients to associate same-sex attraction with pain or nausea. Patients are given a drug which makes them violently ill, and they are then shown pornographic images and sound recordings whilst they violently vomit. That is not counselling. And usually patients would experience a session every 2 hours, night and day, for 3 whole days. That is not counselling. Then there is electric shock treatment, where a person responding to same-sex stimuli is shocked so the response is associated with pain. That is not counselling. Now, Mr Bailey, imagine the outcry if in this place our Parliament gave tacit approval to curing heterosexual men and women with their heterosexuality. Imagine if it was in reverse. It would be an uproar. If we allowed conversion therapy to try and turn our straight colleagues gay, it would simply not last a day. And yet we allow therapists to peddle the myth that they can cure people of being gay. And it would be laughable if such views were held simply by crackpots on the fringe of society. It is not. There are some psychotherapists and some NHS staff who have the view that a gay cure is possible. Recent YouGov polling for Stonewall, the excellent LGBT rights organisation, found that 1 in 10 health and social care staff have heard staff express a belief in gay cure therapy. In London, that figure rose to 1 in 5, and that was in 2014. Just 6 years ago, in 2009, the BMC Psychiatry Journal surveyed over 1,300 accredited medical professionals. Over 200, more than 15% of them, had offered some form of conversion therapy. Those 200-plus medical professionals said that 35% of their patients were referred to by GPs. And 40% of those patients with the so-called treatment were treated in an NHS practice. For any health professional to refer someone for such so-called therapy is fundamentally abhorrent, and it's time to call a halt to it once and for all. So where are we today? Despite numerous calls for an outright ban, the practice continues. I accept there has been some progress. In January of this year, the Memorandum of Understanding on Conversion Therapy in the UK was launched, developed by the UK Council for Psychotherapy and signed up by some major organisations, including the NHS. It's welcome, as far as it goes. However, there remain a number of regulators as yet to sign up, and it's voluntary. And the memorandum seems to cover just sexual orientation, but not gender identity, and it's voluntary. The memorandum says practitioners need to be aware of the ethical issues relating to such cure therapies, and that the public should be made aware of the risks of such therapies, and it's voluntary. The memorandum seeks to apply standards to a sector of therapy that has no statutory regulation because it's voluntary. We regulate dentists, but we don't have statutory regulation for psychotherapists. My honourable friend, the Minister, I know has an impeccable record in LGBT issues, especially in health issues. And I'd like to put on record that I know that on this issue and many others, she has a deep commitment to helping eradicate flaws in the system and pursuing equality. So I do have to ask, why are we allowing this abuse, this so-called cure therapy, to continue? Why are we allowing the practitioners, the psychotherapists, to simply have a voluntary code of practice, simply a memorandum of understanding? Mr Bailey, I acknowledge that psychotherapy has a role to play for adults who need support when dealing with a range of issues connected with their sexuality and their sexual identity. Dealing with conflicting feelings is difficult at the best of times, and I do accept the role of proper regulated counselling.